to the Empowering Minds Mental Health Podcast. So today, my special guest is Dr. Wagner, and today she's going to dive into how she blends holistic medicine with chiropractic care, creating a integrative approach to wellness. We'll possibly explore how this connection fosters not only just physical healing, but also mental clarity and emotional balance, empowering you to take charge of your health. Dr. Wagner, thank you for agreeing to come on today.
Well, I'm very happy to be here with you, Jennifer, today.
Thank you. All right, so we're just going to jump right into it. So, how did you become interested in integrating holistic medicine with chiropractic care, and what inspired you to take this approach?
So, I really believe that chiropractic is a very holistic mindset already, and chiropractic itself have very strong foothold into that holistic medicine. When I started the chiropractic care, I was a young woman, 21 years old. I didn't know a lot. My dad was a medical doctor. I knew I wanted to step away from traditional medicine, and I was interested in how to optimize my own system. So, my system, my body, would work better. I knew I was not perfect. I knew I had some challenges with my mind, with how I was interacting with others. So, I really wanted to better myself first. And I thought, going to a chiropractor and then making it my profession made sense. And it felt like putting my finger in a hole and being grabbed into it. And so when I started with the chiropractic very early on, I was interested in the nutrition part. Then I
Mhm.
added the emotional, then I added the energy healing piece. So it all flow was in my own head and it started making sense. Today, I use a lot of quite a variety of tools in my practice to help people really understand. And I think that's what people like when they come see me. It's like I'm not just a chiropractor. I'm not just I just don't look at nutrition. I'm just not just an energy healer. I can do a little bit of the harder chiropractic. I can do the gentle work. I can look at your diet. I can look at parasites. I can look at toxicity and
Mhm.
look at what the body needs and ask the body for priority so that what do you need to do to start feeling better tomorrow,
Yes,
not later.
yes. So I started looking at holistic practice and chiropractic care. Well, actually, my chiropractor is the one that introduced me to it. So what I realized is that some of the things I was eating, like white starches, is what was causing a lot of my flare-ups. So I
Yeah,
was really thankful for him because he got me to look at the nutrition side and how it made a connection with chiropractic care. I never put it together. So I was
yeah.
always grateful to him for that. So I'm very mindful, even though I love white rice, I very, very seldom eat it. And if I do, it's only like a small bite.
When you start to understand what makes you feel the way you feel, that feeling is not so good.
Hmm.
You like knowing what's going on. I remember I had a client in France and I did an initial evaluation with her, and I told her, I'm like, I think a big part of your problem is the dairy you're eating, the cheese. And I'm going to make a recommendation that you're going to stop eating cheese for 4 weeks.
Hmm.
And she looked at me and she's like, I don't like you. I don't want to stop eating cheese. I'm like, this is my recommendation. This is for me to help you feeling better. And she left my office feeling really good. The chiropractic care helped her with her joint. She had a lot of joint pain. And
Hmm.
she kind of listened to me and she stopped doing the cheese. And I told her, you have to stop cheese for 3 weeks. And after 3 weeks, she's like, oh, I kind of like this doctor. I feel good. But I think it's her treatment that made me feel good. It's not the cheese. And then she started eating cheese again and all her joint pain came back.
Yep. Yeah,
And she's like, I
absolutely.
don't like that you're so right.
Those flare-ups are horrible, so I can
They're
imagine how she
horrible.
felt.
Mm.
Okay. So I want to ask you another question, and I wanted to ask you too, your volume is kind of it goes up and down a little bit, like I can barely hear you.
That's so weird. Um, I don't know what I can you hear me better if I put
Yes. That
right?
was perfect.
I'll try to hold it closer.
Okay, perfect. All right. So my next question, can you explain how genetic nutrition plays a role in like your treatment plans that you develop for your clients and how that may give them a better understanding how to live with better health outcomes.
Of course. So genetic nutrition is the idea to look at genes and that we're not have all the same genetic materials. I see a lot about I started being interested into it when I started working with a Russian descent woman that had some issue with digesting vegetable oils.
Mm,
And I don't know why exactly. I'm guessing that because in Russia there's not a lot of vegetables that produce oil, and the diet was for a very long time poor. So I believe that Russian women don't have a lot of digestive enzymes to digest those oils that their ancestors were not in contact with.
hmm
I see the same thing with soy. I find that a lot of white people don't digest soy very well. Asian
mm,
digest soy very well, but not a lot of white people. So for me, it was interesting to look at how genetic affects your makeshift and how some genes you might have, some gene you might not have, might need to be supplemented with with nutrition, with supplements
hmm
to help you live in the environment that you're not familiar with. We live in a very small world now where Russian women don't live in Russia, they live in the United States, where white people want to eat the soy. So we have access to a lot of food and a lot of things that our system might not have been in contact with before our generation. And so, what can we do to help the body digest, integrate? We might not have the digestive enzymes, the the genes to
mm,
process and to create what we need to break down that food.
mm.
Does that make sense?
Yes.
So in genetic nutrition, there's a few things we're looking at. One of them is the MTHFR genes, which is used in methylation, the methylation of B vitamin specifically. So some people are missing that specific gene to methylate vitamin B and having a hard time detoxifying and methylating those vitamin B to use them efficiently.
Okay.
So when we know that's going on, we can help them by supplementing them with some either digestive enzymes or different supplements to help them with that.
Okay. All right. So you have a book. Do you talk about this in the book? Can you
I
tell
don't
us
talk
about your
about
book?
I don't talk about genetic nutrition in the book. The book is more about habits and about how to create a better lifestyle for yourself and really like connecting to your higher self to create better habits for yourself.
Okay. And what is the title of your book again?
The title of the book is Shattering Habits.
Okay. Is that available on your website?
It's available. I don't know if I have it available on my website. That's a really good question. It's available on Amazon.
On Amazon. Okay.
Mhm.
Right. Okay. Now, you use several cutting edge tools like ionic foot baths and PEMF therapy in your practice. I really want to learn about that. So could you share how using those technologies support your patient's healing and overall well-being?
So I've been a chiropractor for 20, almost 25 years now.
Mhm,
And for half of that time, I was just a chiropractor using just manipulation to help engage the nervous system, help people disconnect with their body and feel better in their body. And when I came back to the US 11 years ago, I recognized that the nervous system was not just stressed by alignment and stress, but also stressed by the environment and especially
mm,
the toxicity in their environment. So I started looking for modalities that could be helpful for my patient to detox, to regenerate their body system. So
mhm,
the ionic food detox bath that you mentioned is a detoxification system.
mhm,
Helper, where you put your feet in warm water and there's a small electrical current that runs while your feet are in the water
mhm,
to create electrolysis, and the electrolysis is going to pull all the ions out of your body into the food bath, changing the color of the food bath.
Mm-hmm.
And you can really see what depending on the color, what comes out of you and what systems are being helped by the food bath.
Mm-hmm.
The PMF is more regeneration, and the PMF works on microcirculation, and it's going to help the body system to get more blood flow into areas that are very stuck. So chiropractor work a lot on stiffness, and neck
Mm-hmm.
stiffness is a big one. And so when I was looking at my patients' neck stiffness, I wanted to find a way to help them feel better faster. And the
Mm-hmm.
PMF made a lot of sense at that level to help with the microcirculation. So people start feeling like first they really relax on the PMF mat. It feels really good to be on it.
Mm-hmm.
People take a nap, feel very, very relaxed. That's really the main thing. And in that relaxation, there's blood flow and their neck starts moving even better than just after a chiropractic adjustment. So I like adding the two together.
Gotcha. Okay. So with the ionic foot bath, I started doing those, I guess about 2 or 3 years ago. And
Mm-hmm.
I was kind of hesitant because I'd never heard of it before. But the very first time I did one, the water was like almost
Too
like
nasty.
sweet tea. I mean, it was super dark. And I was like, oh my gosh. And so I signed up again. And then the next time it was dark, but it was almost like a dark oranges. And I was like, oh my gosh. And it really detoxed my body.
You
I could
sleep
really tell.
better, you function
Yes,
better, your brain works better,
absolutely.
you feel lighter in your body.
Yes.
Even if it, I had a hard time convincing my husband in the office. My
You
husband
cut
was on,
off.
I'm sorry, I was saying I had a hard time convincing my husband that we needed to get an ionic food detox bath in the office. And so at first he's like, oh, I don't know. I'm like, let's get it. Trust me, it's a good, I mean, I did my research. It's a good product and I got a really good one. So I was excited about
Hmm.
it. And what convinced him was that when after about a month of having the food bath in the office, one of my patients came in and did a food bath. And a phosphorescent green color came out of her, a color that I've never had seen before, that is not on the chart, that you don't know anything about. So I asked her, I'm like, I don't know what this color means. What did you get involved into? What's going on in your life? And she's like, no, nothing, nothing, nothing. Did you do anything out of the ordinary? Nothing. And I was like, this is weird. So I put it on the side of my brain to be like, okay, I need to do more research on that phosphorescent green coming out of. And 2 or 3 days later, a sister came in and she did a food bath also. And the same color came out of her sister, that same phosphorescent green that I've never seen before, that I've never ever seen since, which was like years ago. And I asked her, I'm like, so I know I asked your sister that nothing was out of the ordinary in her life. What about in your life? Did you do anything different? Did you spray? Did you do anything? And she was like, oh, we just spray for ants all over our yard and our deck.
Oh, and it picked it up. Yeah,
And
that's
when my husband saw that green, he's like, huh, okay, it really pulls out.
yeah,
Yep.
yeah. And the two together, like I would leave this, it was like a natural spa that I went to for that. And then I would drive like 15 minutes up the street and I would go to my chiropractor. And for me, it really did something for me, like even like mentally, like it gave me like a mental
Better.
boost, like because
Mm-hmm.
I was dealing with a lot of brain fog, and I noticed that when I was consistent with that, not only, was I getting help for my joints, but just mentally, my overall well-being, I felt better. And anytime if I want to jump start to lose weight, that is my go-to.
The food bath. Mm-hmm.
Yeah. Hmm.
Yep.
Yeah. I enjoy those. Okay.
They're very enjoyable. They're very
Oh, yes.
relaxing. It feels really good to have your feet in warm water.
Hmm. Yeah, I
Mm-hmm.
enjoy those. So I want
Good.
to ask you something. What are some common misconceptions about holistic chiropractic care, and how do you address those with your patients?
So holistic chiropractic care means that you're not just taking care of the physical body. So most chiropractors are body workers where they look at the physical body only. And a holistic chiropractor is not just going to look at your physical body, it's going to look at the emotions.
Mhm.
And emotions are really important because emotions carry a lot of trauma. All the
Mhm.
PTSD is really emotion stored in the system. But it's not just the trauma, it doesn't have to be traumatic. We
Right.
do a lot of things to protect ourselves.
Mhm.
So I worked with somebody yesterday, and our discussion went into the fact that so she had a knee pain, and the knee pain was around her working and not wanting to work the way she works and wanted to be more. So she's a chef, and she wanted to be a chef to be able to do some product in the gastronomic industry, but she thought to have that product, she would need to be a chef to market it. And now she's stuck into being a chef and she doesn't have the time to make her product that she's so interested into.
Mhm.
And her knee pain was really linked with not having the time and being forced to be a chef to make money.
Mm.
So so when you're just a chiropractor and you look at knee pain, you're just going to look at tape. When you have that extra tool, which is emotions, you're going to look at the emotions that might be stored into that area, and it's a different layer.
Mm.
And then there's the power of the like the power of the mind, and that's the next layer in this thing as a holistic practitioner is to look at how the mental affect. So the mental is your habits, and that's why I
Mhm.
wrote the book about habits because I think how you do what you do is really important and making sure that you're doing the right things for you and you're not doing it because culture asks you to do it a certain way. For example, as culture in China,
Mhm.
it is polite to burp after a meal. And if you burp after a meal in China, it makes the host feel welcome and feel good because it gave you a good meal. If you
Oh, wow.
burp at a meal in the United States, you're not very polite.
Right. Right.
So
Right.
the culture we live in and the education we receive and the pattern that we're taught as kids, that either good or bad. And parents, I'm not trying to be against parents. Most kids are not born with a manual and how to take care of that kid.
That's right.
And we generally do the best we can with the tool we got from our own parents. So
Mhm.
it's not about pointing a finger at parents and say you're not being good parents. It's just saying we do things the way we do things because of the culture, because of our education, because how we've been trained to do it the same way. And kids will repeat the same pattern. Kids don't
Yeah.
do what you do. Uh, Kids don't do what you say, they do what you do.
Right.
And so when you, the way you teach kids, so one of the things that I tell my patient all the time is that if you want to teach your kids to be an athlete and to do sports and to have a healthy body and eat healthy, you have to do sports yourself. You have to eat healthy
Yeah.
yourself. You cannot eat a burger and be like, okay, honey, you need to be healthy and give the kid a bowl of cucumber.
That's right.
It
Yes.
doesn't work like this.
That's right. Okay. All right. So that was all of my questions that I had for you, but I wanted to leave you with just a few minutes or a few moments. Is there anything that you want to say to resonate to the viewers who will watch this later on? Anything pertinent that you want to
So for
say?
me, I find it very interesting that you talk about it. I'm really into this concept about empowering minds and empowering bodies. I really feel like this is something that lacks in our culture, in our
Yeah.
education, where we're not taught that we are powerful beings,
Mm-hmm.
that we can very easily and simply change the way we think, change the way our body works, and
Mm-hmm.
change in such a way that our body and our mind become more powerful.
Mm-hmm.
I was just talking to a patient today that put on 40 pounds and was looking at her sister that's overweight and saying that her sister is depressed and feel like overwhelmed with how big she is. And doesn't have the courage to start walking, to stop eating ice cream. And if she does it for 2 or 3 days. And after 2 or 3 days, she's defeated. She doesn't feel like she can do it anymore.
Mm-hmm.
What I see with my patient, and I just did a reevaluation of one of my patients today, is that we did a 3 months of care, and in 3 months, our pains are gone, our tummy aches are gone. She feels mental clarity. She feels like she can do what she wants to achieve. And I know we can change, and I know the mind is super powerful. And it's just doing what we need to do, the important step into taking that on, is just to make sure that we have good habits in place so that it becomes a routine, so that we don't have to think about what we're doing, so that we can have a powerful mind. And when we start working on the mind and the body, it changes. And it changes maybe not in 2 or 3 days, but it changes fast.
Absolutely.
And, and I think the more we have mind, and the more kids and other people out there know that the culture that says you're stuck into a pattern that doesn't work for you, they need to know that they can change. And those changes start with one simple change. And that simple change can be just eating healthier, can be exercising, can be just going outside and breathing. It's really, it's looking at what needs to be done to achieve your goals.
Okay. Well, thank you for your time.
My
I'll be in
pleasure.
contact with you soon to give you the link and everything that you need.
Awesome.
All
Thank you
right.
so much.
Nice meeting you. Take care.
You too. Bye.
Thank you. Have a good one.
You too.